Hello, everyone, and welcome to the final audio of podcast in series 5 on the Ztormtronix case review. This is the scientist, and this audio is on Ztormtronix healthcare workforce and agility. And this is another Storm Robotics production, and this is this audio podcast. I'm going to focus, as I have done in previous audios and podcasts, on highlighting some understanding and context in relating to healthcare, uh, health service related research, and also provide a sort of an overview of how um, collaborative efforts can be approached and can be envisaged as uh, as a sense of unison with regard to how patients and professionals, health professionals, could be um, working not just working together, but also having a more sort of unison where actually um, there's a sense of there's something I would refer to, this is in the literature as well, something that's referred to as a power approach, and and uh, and kind of a way where there's a hallmark, um, um, where future areas of healthcare and practices can actually support uh, excellence in in healthcare and research, um, so that real areas of health can actually be achieved. So I'm going to say a little bit in relating an introduction, contribution, and contributing and participation, and what that really means, and then an overview in relating to a summary on this sort of final audio and podcast in this series, and I will highlight a few resources for further reading as well. Excuse me. So a bit of introduction. In areas of healthcare, tradition has focused on what's referred to as a sort of something relating to how different health professionals um, have a sense of ownership relating to aspects of healthcare, sort of more so than their peers or their colleagues in other areas of health as health professionals. And so, in this context, in this context, two main themes have emerged from retrospective research, including one, the professional arena, and two, professional dominance. And there is literature out there dating back to the sort of the late noughties, in 1998, by an author called Abbott, and Stevens and team in 2000. Now, I'm gonna sort of try and sort of highlight this a little bit more. So, professional arena is where excuse me, where professionals or professions such as those working as allied health professionals, for example, are viewed as less autonomous, and who negotiate their tasks or their sort of day-to-day areas of professional practice in the workplace to maintain or expand um, in areas of the professions that they are part of. Examples of this can be identified in work by an author called Allen in 97, and Strauss and team in actually in the early 60s as well, and actually Svensson in 1996 in the late 90s noughties as well, where authors basically describe working relationships and hierarchy between doctors and nurses. And actually, in relating to, and by the way, listeners, relating to allied health professionals, generally speaking, allied health professionals, or even another terminology that's been mentioned in a previous audio podcast, relates to something referred to as multidisciplinary team working. Technically speaking, MDT, or multidisciplinary team working, or MDT, and allied health professionals can the terminologies can be used in synchronicity. They can be used used together, and the thing is here is that relating to allied health professionals, however, and even multidisciplinary team working, normally when there is in relating to how literature has been contextualized in and around areas of healthcare, when it comes to AHPs or MDTs, normally it relates to actually the either a link or an integration between how doctors are on the front line and how nurses or nurses are on the front line as allied health professionals and as those MDTs. But there's actually not much literature out there to actually that encapsulates or envisages sort of the other health professionals, and so when literature had been highlighted in by these authors, sorry, when papers were published by these particular authors, they also have a specific area of a specific discipline or kind of genre, if you like, and that is basically the in this context is actually sociology, and sociology is actually for health professionals. Sociology is a kind of a misnomer. It's kind of a gray area in one way or another, at least from a practice point of view, because where healthcare is concerned, obviously patient care is first and foremost, like anyone would know, and everyone should know. But in relating to sociology, and when it comes to linking aspects of sociology and healthcare, there is actually sort of fragmentation in actually some of the way some of the context that has been kind of put in research retrospectively, and so thus there is actually very little inclusion of other health professionals, and this goes back to the sort of the 80s, 90s, and basically in relating to where UK healthcare is concerned, or where UK healthcare is concerned, and where in relating to the National Health Service, and when it was sort of founded in the late 1940s, and around then, obviously, the way health professionals were working then versus now, for example, are also different. But that being said, what I'm highlighting here, dear listeners, is actually there's been this issue where there are health professionals in even around doctors and nurses around them, and also sort of in other areas of healthcare practice. But when it came to sort of putting papers and publishing understanding around different areas of healthcare practices, those sort of health professionals haven't been captured, and um, and so and professionalism in this context has not really been highlighted. There has been, however, in one way or another, there has been papers been published by authors in sort of in the last I guess a couple of years. I think it is in 2018 or 2017. Between 2017 and 19, there had actually been some effort in relating to sort of a workforce and sort of an evaluation around workforce, and the authors sort of looked at different areas of practice with a sort of a premise really around sort of the nursing professions, but and the paper I think sorry listeners, I think the paper is, or the framework or the evaluation is in the list in the list of resources that I will say towards the end of this podcast. But suffice to say that actually there was uh, there was there wasn't a focus on any other health professionals then. But having said that, when people, generally speaking, as I'm sure listeners would know, that when people are actually doing research and are looking to identify aspects that could be improved, or how areas of practice could be bridged with relating to workforce, then basically what happens is that the uh, collaborators who do research, they focus on specific objectives, and those objectives can be quite rigid, and so therefore um, it stands to reason why sort of only now, sort of in the after the new millennium sort of kicked in, there was more strive to look at sort of professional working relationships in areas of healthcare, but again, the dominance has mainly been around clinicians or doctors and nurses. Professional dominance in this context relates to emphasis on sort of where health workforce, where the workforce from one branch of healthcare interrelates, or perhaps not, in areas of healthcare between one area and another. Research, for example, has highlighted that those in sort of so I'm going to say this in inverted commas, powerful professions. So, for example, i.e., in medicine, for example, and again, frontline healthcare professionals are able to set terms of their work, whilst those where there is where you have MDTs, or allied health professionals, for example, doing and end up doing, or a part of the premise of their, for example, their job description, for example, they in comparison are doing the so-called doing the dirty work, and that's passed on to the allied health professionals, and mainly this is because the skill sets that are aligned to different allied health professionals, again, have not been sort of outrightly documented, where in literature there is there is sort of a body or contribution of research from different allied health professionals to put perspective. There was a paper in by Brannan in '94 and Frierson actually in the 1970s, so way back, and in 1988 highlighted a little bit about this, and I won't delve into this. It's not my area of understanding, but it so those who are listening and sort of trying to get an understanding around this, feel free to check out the works by these authors. But because the excuse me, because of the increasing popularity of the powerful approach, and again inverted commas, stand as hallmarks excuse me, stand as hallmarks um, are stand as hallmarks professionalism and dominance and autonomy, especially more so over the last few decades. So where healthcare is concerned and the delivery of healthcare and the way healthcare service is provided, healthcare has thus shifted more and more, and this is why um, uh, there is either so for example in a previous podcast I mentioned, for example, PCNs, something called referred to as PCNs, or primary care networks, at least in the UK. And what the aim of the PCNs and what they're about is basically where you have different allied health professionals sort of working under one roof, so to say, and wherein different skill sets can be applied against different areas of practice according to the sort of demand, if you like. And so therefore there are areas of where nurses, nurses as frontline practitioners have um, they have absolute or can absolutely outweigh clinicians or frontline health professionals in that regard, and where, for example, other health professionals also outrightly have more um, sort of basis than providing understanding than clinicians, for example. And in this context, where, for example, evidencing aspects of healthcare can be applied, they each health professional has a role, has a sort of a play in the and I'll refer to this as a in the game of healthcare. uh, and so and again, works by Abbott 98 and Abbott. There's two papers in 98 by Abbott highlight this, and how healthcare delivery has been achieved or can be achieved, and it can be traced back to early 19th century actually, as well, at least in relating to modern day medicine. And there's a paper by Shergold and team in 2008. In England, the debate of these issues stretches back to the first eminence of public funds to inform health practices. So the sort of the literature in one way or another kind of dates back, retrospectively, in the 1970s, but and since then obviously there has been move to actually sort of where other authors who look to inform areas of healthcare and practices have looked to do things around this in one way or another, and not particularly around sociology, but more around areas of, for example, between health sectors. So I've mentioned primary care networks, and so there's the primary care perspective. There's also kind of there has been research by authors coming from a secondary healthcare perspective, but the dominance it relates more around primary care because of how, at least in the UK, there is the commissioning groups who sort of have a duty to sort of ensure that the wealth within healthcare and between healthcare sectors, not particularly specific to primary care, but how commissioning groups have a role to have a sort of a sense of entitlement to ensure that they can apply aspects of wealth in healthcare appropriately and actually specifically. And the question obviously arises again, and that is to say, in generally speaking, it's it can be is problematic in one way or another, but then where commissioning, where aspects of commissioning and funding are concerned, no one's really asking, the general public or those who use services, which again, it, where there is some of that, it is more recent, and that is in relating to for example, in Involve in 2014, and the National Institute of Health Research, NIHR, sort of developed, I think it was a collaborative effort where they developed sort of the patient public involvement initiative, so that actually wherever there are issues in healthcare and how different things can be addressed in healthcare, the patient and public involvement, or PPI, can actually help to achieve some of those things. Except again, in certain areas of healthcare, in particular, particularly relating to long-term condition groups, if there was if where funding is concerned, for example, in long-term condition groups versus things like terminal illness, like things like relating to cancer, predominantly funding would more irrespective of sort of aspects of involvement. What tends to happen is when it comes to cancer research, for example, that sort of takes eminence over long-term condition groups, in at least at least there is that sort of understanding and perspective. Now, I'm going to talk a little bit about contributing and participation. And participation sort of sort of relates to the patient and public involvement aspect, but I am going to do what I can to integrate some of that understanding in another way. So today's healthcare workforce hierarchy sort of remains somewhat the same, yet contemplation reveals that collaborative patient-centered services are required to promote the active participation of each discipline in patient care. So there's a paper by I mentioned the author in a previous audio podcast, by by Soclaridis and team in 2007, and basically in relating to the sort of the audio this audio podcast title about healthcare workforce and agility. An agile healthcare workforce enhances patient and family-centered care and values provides mechanisms for continuous communication among patient and professionals, and optimizes staff and patient participation actually in clinical decision making. Written with making sorry In clinical decision making within and across certain healthcare specific areas of healthcare disciplines, and sort of also fosters a respect for interdisciplinary contributions from allied health professionals, as well as those on the front line and frontline health professionals, and works by Soclarides sort of highlight that. There is other more recent papers that highlight that as well. And Also, in this regard, though, it's important to place understanding of what the role for what role I suppose this is an area that got my intrigue when I was looking at over the work by the renal patient support group team, the RPSG team, when they looked at again there was a systematic review that had been published relating to the sort of the role of healthcare scientists and also within the evidence base excuse me, around the renal patient support group. Uh, there is other works relating to different kinds of ways of how these particular health professionals can get involved in aspects of service or healthcare service delivery, and not in sort of the traditional, not in the traditional sense. And by and large, healthcare scientists, or where scientists are concerned, they kind of sort of do things from a laboratory perspective, and albeit there is sort of a sort of an integrated way that they can that involvement can surround, except that the issue is that even the sort of professional bodies that they that they may hold register under, for example, to ensure that they can practice aspects of their day-to-day in sort of laboratory environments, where there is a sort of still a traditional sort of sense of attitude to how scientists should be doing things, and and therein obviously therein is a bit of a problem in that regard. So anyway, excuse me, in this regard, it is important to place understanding of um, what they can do, how they can how they are involved in patient care, and appreciate the sort of knowledge base and that expertise. So healthcare scientists in generally, and where research is concerned, on those excuse me, where healthcare scientists in and around different areas of research, and focuses on the areas of sort of service within in healthcare, or the National Health Service. You tend to have, for example, your biomedical scientists, or your clinical scientists, or your consultant sort of biomedical scientists, or consultant clinical scientists. Each of them have a sense of place, but the issue is that when it comes to sort of imparting knowledge, or when there are areas of practice that they can get involved in, more often than not, it's restricted to areas that still, or are confined, sorry, are confined and restricted as well, restricted and confined to still in aspects of laboratory practice. And so in this regard, again, I've mentioned the renal patient support group or the RPSG before, and there's effort there where the sort of team have put together lots of different understanding or lots of different ways for patients and professionals who look to develop area of practice and in healthcare around kidney, mainly around kidney or chronic kidney disease, and where actually there is there is a place where, for example, people can from different perspectives, whether in public from the from public for those on public health, those in the public domain, and those who are from healthcare in the healthcare sort of domains, can actually interact and kind of use the RPSG as a way to gain understanding, and that and therein it's the RPSG is kind of a apart from raising a sort of, there's this awareness aspect, there's also this aspect where the research actually is where those scientists who are in laboratory practice could be doing more, so thus to ensure that there is a sort of ongoing, apart from professional development, because everyone in every profession has a sense of professional development in one way or another, but where scientists or healthcare scientists are concerned, much like any other health professional, to be able to document aspects around their practice, to the extent where, for example, there is propagation for it to be published, then in this context, that means that the science is basically where, for example, whether biomedical scientists, whether clinical scientists, whether consultant clinical scientists or consultant biomedical scientists, that they all have a premise where they look to share and disseminate their knowledge or understanding through real issues around science and medicine, and that way actually ensuring that patient care can really be achieved. And things like that are happening or have been happening through the, for example, again, the renal patient support group or the RPSG, since around, as far as I'm aware, since around 2009. So, and so um, the terminology, by the way, listeners, is something that I don't really like to say about too much. But where I've said, for example, where there can be a sort of a sense of hierarchy between different health professionals or health professional groups, something that's in literature that's been the terminology being used in literature, and it's quite a stringent word, I would say, is some or wording, is something referred to as division of labor, or medical, or it can be referred to as a medical division of labor. And so uh, again, sociology isn't something that's my kind of my strong around my kind of strong understanding, but when I'm getting at is when it relates to where healthcare is concerned, actually, when where healthcare is concerned, sociology is kind of a has always been a standard place of where literature emanates from, kind of has again, I'll use this word. It's in what I've written, what I've read already, and that is to say that there's a dominance around sociology in this context, and that's and wherein healthcare is concerned, and specifically around healthcare, um, actually, it is health professionals and not sociologists, for example, who need to contribute back into practice. So thus, actually, where they can define aspects of their areas of healthcare that they're involved in, that way, the NHS, or at least in the UK, the National Health Service, actually can be a sort of a smarter, a more sort of attractive place to be working for all health professionals. And actually, if that's the case, if that can be achieved, then actually patient care would actually really mean patient care. And so I'm going to highlight a bit of a summary now. Also a sort of an overview. This so what this also means is that uh, whether healthcare scientists, whether nurses, whether clinicians, whether physiotherapists, whether optometrists, whether pharmacists, whether surgeons, whether whether involved in pediatrics, or whether in sort of musculoskeletal health, or just where there is increase where there is involvement around different areas of healthcare by different health professionals. um, they are required to kind of have that sort of functionality where they are sort of multidisciplinary, and also are effective practitioners, and in that context, having ability and actually fitting in capacity to where they can teach and educate non-specialists. And actually, there's a book by Pitt and Cunningham which was published in 2009, which kind of give this perspective from kind of a sciencey kind of perspective, but it is actually quite approachable, and are expected, generally, where this where this is concerned, is basically where there's a where researchers, and also excuse me, where researchers and sort of non-specialists, sorry, where there's sort of a sense of professionalism and understanding around different aspects of healthcare. There is uh, work in Pitt and Cunningham in 2009 to suggest that actually different health professionals have a role as practitioners, to thus at least teach, to sort of educate, from in one way or another, and are expected to expand expertise excuse me, expected to sort of expand expertise across sort of long-term condition groups, patient cohorts, and sort of across and in between healthcare sectors, owing to a rise that's surrounding in, especially more so now than ever, because of the way the internet is, and online information is, because of the rise in technical language, and issues around that can surround areas of health literacy. Um, 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 in relating to this, patients with long-term health conditions could be supplemented with with different kinds of understanding from different health professionals, and in research by the RPSG team, the renal patient support group team. In one way, in some of the works that have come out from there, they've highlighted that there is for example, there is sort of where there is expertise, there is or should be excuse me, there should be effort where all of them, all different kinds of professionals impart sort of an understanding based on case scenarios, and so so also, unless there is is a necessary sort of area of training, and training change for sort of health professionals or different health professionals, sort of to work smarter and more collaboratively, then unfortunately things don't really where at least when it comes to areas of healthcare, it's always reverts to the default, which is doctors and nurses, for example. And so a new generation of healthcare professionals will will continue to work, or are trying to work in sort of in status quo environments. However, initiatives are out there to kind of sort of highlight and suggest that there is opportunity for different health professionals to get involved, and in line with sort of the sort of legislation or the governance around patient and public involvement, and so there is literature out around this as well, to say, for example, where initiatives, for example, those that are through social media can be can be are unlikely to become sustainable over time. And in this context, it's important to appreciate again how patient and public involvement efforts are, and also in line with patient and public involvement, what is required by health professionals to ensure that aspects of what they do and what they're looking to do are getting funded. Because what happens, and what tends to happen more often than not, is that again, and this should probably not surprise any listeners, is that health professionals benefit more than patients in this context. And what when it comes to sort of one way to bridge this misnomer is actually where, for example, patients and professionals working on certain areas and initiatives, for example, there should be, number one, a collaborative effort, and number two is actually where, for example, at the end point, authors, whether patient or professionals, if there's ever if they've collaborated, for example, then actually they should, when it comes to one of the one of the main things out of research is to have sort of a way to disseminate knowledge, and that could be through a paper publication or a poster or whatever. And in one way or another, it should be to the thing, a thing where basically on the end sort of I use this word in inverted commas, the end product in this context should be that both patients and professionals should be co-authors on any final publication, for example. So that way, if a patient is if there's a member of the public or a patient involved in aspects of research, if they're struggling, or for example, and I'm just giving a typical scenario really, if there is a struggle with relating to looking for areas of employment or etc., to the publication may help those in looking for employment in areas of healthcare, and so thus to ensure that um, the drive and the enthusiasm around healthcare research by those who are in the public and patients as well as professionals actually is something that can be sustainable. And that's where I'm going to end this audio podcast. I'll read out a few resources and you're welcome to check these out at any time. There was quite a few papers by Abbott. One of the ones was by Abbott in 1998, and I wouldn't again really highlight too much around, for example, sociology work, and that might be in one way or another. It's probably my own biases, listeners. But if there are any sociologists listening, I apologize. But basically, when it comes to sociology, what sociologists seem to do very well is actually segregate areas of healthcare, so that actually the division of labor actually benefits them through areas of their research and not actually patient care. But this paper is actually quite good. It's by Abbott in '98, The Sociology of Work and Occupations, and it's an annual review. It's published in the Annual Review of Sociology, and there's a paper by Barnett and team in 2012, Epidemiology of Multimorbidity and Implications of Healthcare Research and Medical Education, a cross-sectional study, and this was published in the Lancet. There's a paper by Brannon. I think I mentioned Brannon in the context that was sort of read out. So Brannon in 1994 has a paper on a publication on intensifying care, the hospital industry, professionalization, and the reorganization of nursing labor, and this was actually a chapter in a book actually, and the book was actually called Intensifying Care. Then there's there's the book by Friesen and Friesen. Sorry, it's a chapter in a book, and it's by Friesen in 1970, believe it or not. But then there was an update in 1998. But the chapter, either one of those, is I think in a book called Profession of Medicine, a study of the sociology of applied knowledge, and it was published in the University of Chicago Press. And again, not really. I guess because of the aspect around the medicine and the clinical aspects. That's one of the reasons. One of the main things that attracted me to dig out that work. And then there's a paper by Green and Hibbard in 2012. Why does patient activation matter? and that was published in the Journal of General Internal Medicine, and it's an examination of the relationships between patient activation and health related outcomes. There's a paper by again, I mentioned this one, Nutbeam in 2018, and his colleagues, health literacy in context, and this was published in the International Journal of Environmental Research, Public Health. And then there was there is the one by Svensson in 1996, the interplay between doctors and nurses, a negotiated order perspective, and again, it is actually published in a sociology of health and disease journal. And finally, I'm gonna give out this one, and that is the King's Fund in 2018, a vision for population health towards a healthier future, and it's available online. If you just put in a vision of for population health towards a healthier future in your search engine, you should be able to get that. And that's it. So this is this was The Scientist, and it's the audio podcast on the Ztormtronix case review. And this has been another Storm Robotics production on Ztormtronix healthcare, workforce, and agility. I hope you've enjoyed the series, and really enjoyed being able to talk about these things. And we will look to think about doing another series later, but for now, that's 5 series. Feel free to peruse through the different audios and podcasts. They're available on YouTube, and you can access them anytime, and just go over the works at your own leisure. Thank you, everyone. It's been really lovely.